This video is about Pareto charts or Pareto diagrams. What they are, how, why, and when to use them, and how to go about creating them. Pareto charts were first described by management consultant Joseph Juran, who is often called the father of quality management. Unlike the common tendency to name a discovery or disease after oneself, Juran selflessly named his creation after the Italian economist Vilfredo Pareto, of the Pareto principle fame. In a paper published back in 1896, Pareto noted that 80% of Italy's land was owned by 20% of the population. He found a similar pattern of land ownership in other countries he studied. The story goes that Pareto's principle was based on his initial observations that 20% of pea pods in his garden contained 80% of his peas. Juran similarly noted that the majority of organizational effects resulted from just a few causes. The Pareto principle is also known as the 80-20 rule or the law of the vital few. It states that for many events, 20% of causes are responsible for 80% of effects. The premise is that identifying these vital few 20% separates them from the trivial many. Then you can prioritize your efforts and direct your resources to where they may result in the greatest impact. A Pareto chart is essentially a vertical bar graph. The lengths of the bars show the frequency with which an event occurs or what it costs. Typically, a Pareto chart is rank ordered with the longest bars to the left and the shortest bars to the right. This allows the viewer to understand which situations occur more frequently or are more significant. The thinking is that process improvement efforts will be more effective if the categories on the left, which represent the vital few, are addressed first. A Pareto chart is a great process improvement tool and can be used in several situations. It is very useful in analyzing data about the frequency of problems or causes in a process. Healthcare improvers frequently work in resource-constrained environments, and Pareto charts help them prioritize their efforts and focus on the most significant problems or causes. A Pareto chart visually highlights the most common source of defects or problems among a typically long list of issues. These charts are also a very clear visual tool to communicate your data and findings with others. Now let us go over some key steps in creating a Pareto chart. First, decide on categories to group causes of the problem or event that you are analyzing. These will ultimately go on the x-axis of a Pareto chart. Next, decide how you will measure the causes of the event or problem. You could count how frequently the causes in each category occur, their cost, or the amount of time they take. This measurement will ultimately go on the y-axis of your Pareto chart. Next, collect data or organize data you already have and classify them into the selected categories. You could use the absolute number of events, or you could calculate percentages of frequencies for each category. Determine a logical scale and mark it on your chart. Finally, construct and label bars for each category. The tallest bars go on the far left and follow a descending order. You may choose to calculate and graph cumulative frequency. Cumulative frequency is the running total of frequencies, the proportion of the total number of events accounted for as each successive category is added. Here is a scenario where the staff of a hospital wants to reduce medication errors, a serious and avoidable issue. A medication error such as a wrong medicine or a missed dose could result in patients having disastrous side effects. The staff are concerned because in the past 3 months, there have been 60 medication errors. A Pareto chart can be used to understand causes of medical errors. Key causes of medication errors that the staff identifies are clinicians giving a patient the wrong medication, the patient being given too much or too little medication per dose, staff forgetting to give the patient a dose of a medication, storing the medication improperly, which increases the likelihood of the medication being less effective, and giving the medication to patients at the wrong time. The data you collect has counts of the number of patients treated over the past 3 months and the number and types of medication errors that occurred. You find that of the 60 errors that occurred in the past 3 months, 2 were due to the wrong medicine being given, 4 due to overdosing, 10 due to underdosing, 6 due to a missed dose, 18 due to improper storage, and 20 due to medications being given at the wrong time. This is the Pareto chart that you generate based on your analysis. The left vertical axis shows the frequency of occurrence of the error. The right vertical axis is the cumulative percentage of the total number of medication errors. In order to lower the number of medication errors by 80%, we need to solve the 3 most frequent errors: medications being given at the wrong time, medications being stored improperly, and erroneously lower doses of medications administered to patients. These 3 categories account for 80% of the total causes for medication errors. An appropriate action in response to this information might be to observe and map practices for the administration and storage of medications in this hospital and to identify opportunities for standardization and improvement. So as you see, Pareto charts are a visual process improvement tool to separate the vital few from the trivial many. A Pareto chart can help you decide which improvement efforts to make first. It is likely that your efforts will be more effective and will have a higher impact if the categories to the left of the Pareto chart, the vital few, are addressed first.